Good afternoon. Happy Monday evening. I hope everyone had a wonderful weekend and belated Happy Mother's Day to everybody out there, particularly the mothers. Watching the news this weekend, late last week and into the weekend, a couple of new things came out. Number one, disappointingly, hydroxychloroquine has been shown by two substantial studies to have no effect on COVID-19. Once again, as everybody knows, early on, there was thought that maybe this would be the silver bullet. It's cheap, it was a pill, ready available, but unfortunately it does not look like it's going that direction at this point. Number one. Number two, early on, there was some concern that certain blood pressure medicines may actually predispose you to having a worse condition with COVID-19. The two particular medicines that were in the news were ACE inhibitors and angioreceptor blockers, or ARBs. And that was found to be not true. Not only ACE inhibitors, example, lisinopril, enalapril, ARBs, for example, losartan, but other medications were studied as well, beta blockers, calcium channel blockers, diuretics. All those medicines, all blood pressure medicines, have been shown to not make COVID-19 symptoms worse. Therefore, if you are taking those medicines, if you should be taking those medicines under the guidance of a physician, continue to take those medicines as recommended. They are not dangerous with COVID-19. The cases of this insidious inflammatory condition with children is still an issue. Last week I talked about 70 pediatric patients. The number is about 100 now. It is an inflammatory condition, and it is an exaggerated inflammatory condition that affects the entire body. In the pediatric population, is causing severe abdominal crampiness, GI symptoms, rash, red lips, red tongue, and unfortunately, inflammation of the blood vessels around the heart, and obviously could be very dangerous. And the experts believe that this is related to COVID-19, as those children who are suffering with this have either tested positive for COVID-19 or the virus that causes COVID-19, SARS-CoV-2, or they were exposed to people with it, whereby those people tested positive. The disease is real, and we don't know if this is a mutation of SARS-CoV-2 that is now starting to affect our pediatric population, both young children and teenagers. Is it a mutation of it? Is it another strain of it? We're not sure. We know that it seems to be related to COVID-19, and I'm watching and talking to my sources for you to make sure that I give you the latest information about that. Okay, so hydroxychloroquine, not effective. Blood pressure medicines, not affecting the disease. In other words, they're safe to take. COVID-19 seems to be starting to affect children where previously it hadn't before. This weekend I needed to run to the supermarket, pick up something. And as I was about to go in, mask on, social distancing, I saw one of my patients coming out, and she had just finished chemotherapy for cancer, a type of cancer not important for her privacy. I noticed that she was wearing a mask, and I said hello to her. She said hello to me, and I thanked her for wearing a mask. And she said, it's the least she can do in this community to protect others from catching the virus if she had it. She is my patient. I was comfortable to ask her that, was she diagnosed with it, because as far as I knew she wasn't. And she said no. She said, but I know that many people are carriers, and the last thing I would want to do is spread it to someone else should I be a carrier without symptoms. I went on my way into the supermarket, and there were people wearing masks, and there were, aisles that you had to walk one way, and not the other, and there were a lot of people there not wearing masks, not wearing facial coverings. And I thought, I think there's a lot of people that just don't understand, because this is my community that I've lived in for many years now, and I'm taking care of those that are ill in my community for many years. And I know the wonderful human beings that they are, the wonderful Christians they are. I know the ethics they hold. I had a cancer patient walking out with a mask, not to protect herself, but to protect others. And I have patients, people, community members in the supermarket not wearing masks, not knowing that they should be concerned that if they spread this virus to that one particular person, that she would likely die. But in my heart of hearts, I know that these are good people. These are good people wearing masks, and these are good people not wearing masks. I don't think the message is getting out. I don't think the message is getting out by the news media. I get it, and you get it, that if we don't open up our businesses, our country's financial issues are going to be a wreck, and they already are in danger. I don't want to get political, nor do I want to get economic right now. But as a physician in this community, I have to recognize that unemployment usually means poor health care. So I can't ignore the fact that if businesses go under and our unemployment rate in our community, in our state, in our country, in our world goes up, that it's not going to affect the health care of others. But as those businesses are opening, to walk in there without appropriate protection. And remember, those facial coverings are not to protect you. They're not for you. They're for that person walking out that's finishing up chemotherapy that you don't know she's finishing up chemotherapy. Why was she in the supermarket? Because she lives by herself. She didn't have anyone else to go with for her. There are very good people not understanding that they should wear facial coverings. And I know that they just don't understand, because these same people would have offered to do shopping for that lady who is undergoing chemotherapy to protect her. These same people would stop and pull over and help somebody change a tire on the side of the road. But these same people are not wearing facial coverings, and it's only because they don't understand. Because if they understood that they're wearing that to save someone else's life, and now maybe to protect children from this horrific disease, I think they would wear that. So I need a favor. I'm going to guess that most people who are watching this video right now would wear facial coverings. So I'm not reaching the people that need to be reached. Share this video. This is not about shaming. This is not about making people feel bad. This is not about, challenging people. It's about educating people. And I'm not asking you to be put in a spot where it would be uncomfortable. Just share the video. Put it on my shoulders. Have them call me. I'll take the phone call. My staff is well trained to answer any questions about this. To go back and keep it simple and close with this, there's a virus that transmits from person to person very easily. And all you need to do is be within several feet of somebody who's carrying it, and you're likely going to carry it too. It's a virus that transmits easily, that we have no vaccine to prevent, that we have no medication to treat, that has killed and will continue to kill a lot of people, and may have mutated and now is starting to affect children. Very small number, very rare, but I remember in January when we were told not to be worried about this because it's a very small number and very rare. When I heard that it's a very rare thing for our children to get it, I shuddered because I remember hearing the same thing back in December and January. And all we have to do is wear facial coverings and you'll protect others. Share this video. Think about this. Pray on this. Let's save each other, Let's save each other. Happy Monday night. I'm praying for all of you. I care for all of you. It's my privilege and honor to do this and to take care of you. And I'll see you tomorrow. Good night.